podcast. My name is Maya, and I'll be your facilitator for today. Cameron's on vacation, but he'll be back soon. First, we'll have a presentation by our public health officer, Dr. Andy Coren, and then we'll have time for some questions from local media representatives who are present, as well as any sent in by community members who are joining us by live stream on Facebook and YouTube. So without further ado, we'll move on to our agenda. Today we'll be focusing on the following topics: Supreme Court of the United States decisions, including reproductive health, gun violence and climate change, as well as updates on COVID-19 and monkeypox, and information about heat and summer safety, as well as child visits and immunizations, and what future media days will look like. So we've got a full afternoon today. So without further ado, Dr. Coren, please take it away.
Thank you, Maya. So these are the items that we're going to cover today. But first, I want to say the recent Supreme Court decisions affect public health regarding abortions, as well as whether science or belief will be the basis of reproductive technology used to protect life, and whether we have freedom of choice or the government intrusions upon privacy, which underlies many recent decisions such as same-sex marriage and in vitro fertilization. This is protected in California for now, but recent decisions are predicted to have a chilling effect on medical outcomes, including mental health, illness, and mortality of young women of childbearing age. Secondly, the Supreme Court decisions affect how we can free ourselves from the scourge of gun violence in our communities, which has become the leading cause of death in children under 19 years old. And in this era of climate change, whether science or politics will be used to protect our planetary environment. These are health-related issues about which we must all stay informed and active. So next, I want to move to the COVID update. In Mendocino County, as well as in the state and the country, we're continuing to see the effect of COVID. Last time I presented COVID BA2.12.1 was the dominant variant, while now it is BA4 and BA5, which together account for over 80% of cases. Despite the lower testing numbers, this is confirmed by numerous studies as well as wastewater testing. On the horizon is BA2.75, which so far is concerning for more mutations and more possibilities of immune escape. Fortunately, we have not seen the proportionate rise of severe illness, hospitalization, or death as we had with some prior variants. But who wants to risk feeling yucky for a week, exposing loved ones, loss of work, school, or play, or long COVID symptoms? In Mendocino County, our test positivity is up to 13.6%, and daily new cases have averaged over 7 days, up as high as 25.4 per 100,000. It may be plateauing, but we're not sure about that yet. Hospitalizations currently in Mendocino County are 5, and the hospital is not currently stressed with COVID patients. The deaths now account for 127 in Mendocino County. The most affected in the state are people between the age of between 18 and 49, who account for 55% of new cases. And in Mendocino County, we currently have 7 outbreaks, which means more than at least 3 people who are involved, and they are connected through their association. We are in the CDC highest transmission and community levels. So what does this mean for us as we decide our personal risk going to work or a class or a party or an event? We're seeing many more people who've gotten COVID now and don't know where or how. Many more are asymptomatic and fewer need hospitalization. Testing is down and cases are underreported. So what is the risk? Should I wear a mask? Remember that we are in a period with many people who have no symptoms but can transmit. So can we change to the next slide? I think it has the Swiss cheeses. Yep, remember that the vaccinations is our first and foremost and best protection, but masks are not far behind. We want people to pay attention to ventilation, especially in schools and institutions. We have active testing programs. We know how to isolate ourselves when we're sick, and there are treatments now available. It is really only when the virus can make it through these many layers of protection that someone is going to get sick and potentially wind up in the hospital or worse. So this is how to conceptualize what we're doing right now. I want to move on to what is new in vaccines. The 6-month to 5-year-olds can now get vaccinated with both Pfizer and Moderna vaccines at clinics, and those over 3 years old at some pharmacies. Note that our vaccine dashboard will soon show a decrease in the percentages of people who are vaccinated because of the addition of more people who we are counting, who are eligible. The emergency use authorization for Moderna 5 to 11-year-olds has gone through. So now boosters are recommended for all people over 5 years old. Full authorization has been given for the Pfizer vaccine for those over 12 years old and for Moderna vaccines over 18 years old. What is new in giving all these vaccines is that the interval between the first and the second dose is recommended to be up to 8 weeks and a little longer than we had been doing in the last year and a half in order to obtain the best effects. Also, the FDA has requested a new vaccine to be developed that will also involve boosters in the fall to protect against the Omicron variants, including BA4 and BA5. The current modeling projection is for our current wave to peak in mid to the end of July in California and taper off through August. Of course, this depends on the emergence of any new variants. So our current recommendations are these: vaccinate and boost. In spite of reports of waning immunity from prior infection or prior vaccination, here's what we know. Unvaccinated have 5.3 times higher rate of cases than those people who are vaccinated. Unvaccinated are 6.6 times higher risk of hospitalization than the people who are vaccinated. Unvaccinated have 7.2 times the mortality than those who are vaccinated. And also what's new is that people over 50 with 2 boosters have 1/4 of the mortality of those with only 1 booster. Others who are not at risk, less than 50 years old, should wait for the recommendations for boosters in that age group or for the new booster that's coming in the fall. The second recommendation that we have is for masking indoors in all public places. This is a strong recommendation, but I think it's important to understand that we're in a community of very high risk and very high community level. When we have parties, we should do them and gather outside and keep them small. It is recommended that we test before these kind of gatherings, and if sick or if you have a positive test, stay home. And if you're high risk, ask your provider to prescribe the very effective antiviral treatments if it's appropriate. We continue to recommend isolation for all positive cases for 10 days, but we can test out after day 5 if there is no fever for 24 hours and the symptoms are decreasing. And this is extended a little longer for healthcare workers in hospitals, so it's not 5 days, it's 7 days as a test out. Now moving on to monkeypox. This is an emerging infectious disease related to but milder than smallpox, and it has been endemic in Central Africa for decades, usually with spread from animal to man, and this is known as a zoonosis or zoonosis. And occasionally it's affected people outside who traveled to Central Africa or had contact with someone who had traveled or contacted a mammal from Central Africa. Recently, there have been many, many cases worldwide. More than 12,000 so far have been diagnosed in 80 countries, and there have been 3 deaths. In the United States, we have counted over 1,000 cases. In California, almost 200 cases, with 1 hospitalized for pain control, since these pox can be very painful. We need to learn from monkeypox to respond to emergent diseases from the tropics due to the changing travel patterns and possibly climate change. Spread is by close contact with someone who is infected or their clothes or linens. Most in the United States have been diagnosed among men who have sex with men, although it is not restricted to men, nor is it a sexually transmitted disease. This rash is a little like chicken pox with a prodrome of 7 days, more or less, involving a headache, muscle aches, fever, sometimes swollen glands, and this is followed by lesions emerging, often painful. They start as a red spot and progress into a vesicle filled with clear fluid, then to a pustule with cloudy fluid, and then it opens and scabs. This may start in the face and classically spreads downward, though many recently we're seeing the rash start further south on our bodies. The isolation period lasts until all of the lesions are clear and all of the scabs are resolved, may go on for 4 weeks. This is a DNA virus. So the variant changes that we've seen with COVID, which is an RNA virus, is not likely to be seen and not likely to be an issue with this virus. We do have a stockpile of vaccines called JNOS, which were developed for smallpox vaccine and are authorized, but are under an emergency use authorization for monkeypox. For the unusually severe or painful cases, there's also an effective antiviral called TPOXX. In Mendocino and in the Northern California counties, we have so far had no probable or confirmed cases, but providers have all been notified to be alert and how to care for patients, including testing and isolation. Because this requires some contact, it is not as transmissible as the airborne diseases we've dealt with recently, but it is recommended for people who have an unusual rash to see their medical provider to have an evaluation in a timely way. I'd like to move on now to concerns about heat and safety. The summer is upon us, and I want to remind people that severe heat is a greater cause of death than fires, earthquakes, hurricanes, and tornadoes. It's less dramatic, and the data is usually an underestimate since deaths are often attributed to other causes such as heart attacks. Extreme heat affects the most vulnerable, like the very young and the very old, or the disabled who may or may not be able to compensate. Homeless people, agricultural workers, and other essential workers who must work outdoors or indoors in hot places, and often athletes who continue playing when they're stressed. The vulnerability varies from individual to individual. Some medications and alcohol disable normal heat regulation, and that would put more people at risk. Symptoms may include muscle cramps initially, then heavy sweating, and later cold and pale skin with nausea, vomiting, and fainting. Finally, there's a high body temperature, dry skin, rapid pulse, and loss of consciousness, possibly followed by death. Mendocino County Emergency Preparedness has a surveillance plan using a heat risk index that considers temperatures and humidity, and also the time within the season, accounting for when people are more or less adapted to the heat. And also, when indicated, we alert through social and other media so people can take care of themselves and their loved ones. In extreme heat, cities and some community-based organizations may open cooling shelters. We advise avoid strenuous activity and stay cool in the shade or inside with air conditioning if possible. Stay well hydrated, avoid alcohol, which can dehydrate. Never leave a child or a pet or anyone else inside a car, as the temperature can rise 10 to 20 degrees hotter than outside in minutes. And at night, open your windows so there's cross ventilation and it'll cool down. Summer is also a time to play in the water. Please remind your readers to never leave a child unattended playing in the water. Even a few inches can lead to drowning if a child slips and cannot get up. Children should respect but not fear water, so teach them to swim and be cautious of hazards like diving into shallow water. Have them use the buddy system when they're swimming. and to be careful in rivers and in oceans for unsuspecting sudden currents or waves that can be fatal. So now I want to move on to well child exams and preschool vaccines. This is the time to plan for starting or returning to school and extracurricular activities like sports. Children will need to get or catch up to the required non-COVID vaccines, but also consider getting all the children vaccinated for COVID at the same time. There is no interaction between the COVID vaccines or the other vaccines, and it's perfectly safe to give them at the same appointment. Adolescents and teenagers also have some required and highly recommended vaccines to get. Many wellness exams were missed during the pandemic, but are important to arrange on a yearly basis. These are done to find and correct potential problems before harm is done. For example, vision and hearing screening can uncover problems that impede language and reading and cause social problems. Providers also screen and advise on healthy diets and exercise and scope out social and emotional issues in time to correct them. So make your child's wellness visits early and beat the fall rush. And now I just want to go on and say a few things about Media Day and what we're planning. County Public Health has really appreciated our collaboration with media to get the word out to our community. For the last 2.5 years, we've of course focused on COVID, and today we added monkeypox. These are infectious diseases and are very important, but we also want to share issues that public health addresses on a daily basis, including maternal, child, adolescent health, wellness issues such as nutrition, exercise, dental health, mental health, and the growing threats of drug abuse, domestic and other forms of violence, including firearms. In future media days, we plan to address these issues as well as environmental changes that affect our land, air, and water, or the lack thereof, in droughts, and our changing climate, including fires. We plan to involve more people in our department to present on their areas of expertise. Our next regular meeting will continue on the third Friday of each month. And that's all for today. So Maya, if you want to entertain any questions.
Thank you, Dr. Coren. That was so speedy. Let me see if I can. So we've got Lucy and Danilla. Lucy from the Mendo Voice, do you have a question for Dr. Coren?
I do have a question. Thank you, Maya. Dr. Coren, several media outlets have reported that LA County is getting close to reinstating an indoor mask mandate because they fall within the CDC's high spread classification. Is this something that Mendocino County is considering, seeing as we're seeing similar levels of high spread in Mendocino County?
At this point, I'm not considering mandating indoor masks. LA, remember, is 25% of all of California's population. And when they change to these high community levels, it can be very catastrophic, especially for some of the most vulnerable people. And so for them, it is very important to take extra precautions. In Mendocino County, when we have had those kinds of mandates, even if they were started by the state, it has engendered an awful lot of opposition. And I'd rather that our community does what it has been doing, which is follow recommendations and understand the importance of protecting themselves. So at this point, I foresee with the current projections of this virus and this variant at this time, that will be strong recommendations and try and ride this out that way.
Is there any level that we may reach that would require reinstating that? I know we're at a 13% positivity rate, but say we get to a crazy high level. Is that something that you're thinking about, or right now we're just hoping to kind of ride this out?
At this point, I'm going to go with the guidance of the California Department of Public Health. They have discussed a rate of rise, and in LA County, the other thing that's happened is there's almost been a doubling of hospitalizations in the last 10 days, as I understand it. We have not had that here in Mendocino County. So we'll have to see what happens here and in the rest of California and what recommendations come from the California Department of Public Health and their modelers and epidemiologists.
Great, thank you.
Mhm.
Danila from Mendocino Action News. Do you have a question for Dr. Coren?
Yes, I do. Thank you for the meeting and thank you for outlining the calendar going forward of the next media day. I appreciate that. So one of my questions relating to heat exhaustion. We've had some high days of heat recently. Have you seen an uptick on people having heat exhaustion, medical calls? Do you have record of any of that? Is there something that we can, again, tell the community to how to take care of themselves, cooling stations, any other resources for them?
So what we generally go by is a heat stress index. And when that is high, which involves a consideration of both heat and humidity, and as I said before or earlier in the season and later in the season, when it gets to extreme heat, then the recommendations that I made a minute ago will come out in social media and other media. When it gets very high or extremely high, then it is usually the cities and other community-based organizations that may set up cooling areas or cooling shelters for the people who are most vulnerable and do not have the resources to cool themselves. So it is a complex call, and it has to do with the extreme heat during the day, but also the failure of the heat index to fall below a certain amount at night because the stress accumulates over time. So if, for example, the stress is a heat index very high during the day, but it drops down in the evening, then we don't necessarily consider that an extreme or severe heat event. But that could change.
Do you have any follow-up for that, Danila? Are you
I do not.
set
Thank
for
you.
now? Okay.
Yeah.
We've got a question from Facebook or YouTube. Can you please clarify, Dr. Coren, how long people should isolate when they have COVID?
Absolutely. So there's a lot of confusion about this. Isolation with a positive case continues to be 10 days. And there is a possibility after 5 days to come out of isolation if the test is negative, if the fever is resolved without the use of fever lowering medicines, and if their symptoms are decreasing. So many people, when that recommendation or that rule came out, said, oh, well, isolation now only lasts for 5 days. But that's not true. Many people at 5 days continue to have positive antigen tests and can spread and transmit the infection. So remember, the 5 days from having the positive test initially is just a time when you test yourselves, and if it's negative and the fever is completely gone and the symptoms are resolving, that people can emerge from their isolation. However, they should still wear a tight-fitting, high-quality mask for the remainder of the 10 days to prevent the possibility of spreading the infection to others.
Thank you. Another question from our viewers. If I haven't received my second booster, should I just skip it and get the most current booster vaccine?
So if you're eligible, that is over 50, and you've had a booster, or if you're over 12 and there's high risk immune compromise, if you are eligible, you should get your second booster. If in the fall we have, or when in the fall we have a new booster that does protect against the new variants, then there would be no problem in giving that booster as well. The problem now of sitting around and saying, well, I've been boosted once, but I really don't want to get the second booster now, is that there's a significant increase in mortality for people who are eligible for the second booster but have not had it. They've only had one booster. So let me just read that again. People over 50 with two boosters have 1/4 of the mortality of those with only one booster. So that's an important risk.
Thank you. Yes, that is significant, a quarter mortality. Lucy, it's your turn. Do you have any other questions?
I do not. Thank you.
Okay, Danila?
Yes, I have a couple.
Great, go ahead.
One of which I think it's confusing for the public when they hear the new variant, especially BA.5. Is that correct?
The one that we're suffering from now, the dominant one, is BA.5, correct?
BA.5 that is able to get through the vaccine, and if someone already had COVID, is able to get through that immunity as well. Why would they get a booster?
Well, that's a great question, and I think it's an area of a lot of misunderstanding. Breakthrough is not 100%. In fact, it's much, much less than 100%. We notice it and we record it, and we want to understand it from a public health point of view, because the protection that we initially had from these vaccines was extremely high, much higher than many other vaccines. And it was even after just one vaccine. Then we needed the primary series. Then we needed a booster. Now we're talking about a second booster. So the efficacy of the vaccines to fend off the infection has waned. And that's the same thing with the infections. If you've had a prior infection, we used to be talking in the early spring that you were almost as immune as somebody who had the vaccination. And that has decreased. So we now know that BA.4 and BA.5 can break through and people will still get the infection. However, what's very important and gets missed in this conversation is that people who are fully vaccinated and boosted, to the extent that it's recommended at this point, have substantially less serious illness, much less risk of hospitalization or mortality. So again, let me say this. People who have been unvaccinated are 6.6 times higher risk of hospitalization than the people who have been vaccinated. And the people who've unvaccinated are 7.2 times more at risk for mortality than those who have been vaccinated. And vaccinated in this case is, we're talking about vaccinated and boosted to the extent that we're currently recommending it. Does that clarify it? It's not an all or none thing.
Right.
Yes, there's vaccine escape. And so the vaccines don't protect people as much as they used to 2 years ago for those variants, but they still are extremely protective against hospitalization, ICU, requiring a ventilator or dying.
And to follow up on that, two parts, that data is still available on the county website in that new format. And my other follow-up would be, seeing that we're having one vaccine after the other, and for those that were concerned with getting the first vaccine and how that would affect their body, or if somebody is getting vaccine after vaccine, is it still, benefit versus risk? Because there's nothing to be concerned about. Could you please elaborate on that part?
So the risks of the vaccine are very, very minor. If a person gets a vaccine, there's always the risk of local pain, redness, that sort of thing, muscle aches and pains, feeling, weathered for a day or so. So the risks are there every time you get a vaccine. I've heard that in most cases, subsequent vaccines have much less of those side effects. But I've also heard that in some people, they have more side effects from this one than they did, 6 months ago. Is it still worth it? It is, because the waning of immunity, if we use as a surrogate, I mean a substitute, something that gives us an idea of what's really happening. We use as a surrogate the immune globulins in the blood. And so those immune globulins against, let's say, BA1, are initially very, very high, and we also see a very, very, very effective resistance against even getting the infection. But as time goes on, the immune globulins go down, and so people can get an infection, but they're still very, very well protected against hospitalization and death. As more time goes on, we want to get those immune globulins up as high as we can and return a lot of the immunity against the infection and also hospitalization, death. So yes, it's worthwhile to get it. Remember, we have several vaccines that we give to children 4, 5, 6 times before they are, we feel, completely vaccinated for life. And tetanus is still recommended to get boosted every 10 years. So as time goes on, we learn about these things and we make those adjustments in the recommendations. COVID just hasn't been around long enough, and our vaccines have certainly not been around long enough to scope that out. I would hope that after a certain number of vaccines in a certain amount of time, people would be very, very well protected against this and may not even need more boosters. We just don't know yet. It's a developing science. Does that answer your question, Danila?
It does, and I appreciate your answer. Thank you.
Lucy, have you thought of anything else that you are dying to know?
I did want to ask just one clarification. So when you were presenting, you said BA4 and BA5 represent over 80% of cases. Did you mean in the state or in the county?
In the state, in the county, we don't have as much of the whole genome sequencing as we would like. In fact, we were only informed of one of those viruses that happened in late May. So we know it's here, but we don't know the numbers. We can extract those percentages when there are many, many more tests being done, which is happening mostly through the higher population areas.
Okay, great. Thank you for clarifying.
Mm-hmm.
Doesn't look like we have any more questions right now from the live stream, so we might be able to gift Dr. Coren a half an hour of his life back. We'll see. Danila, do you have any other questions? It's a great time.
Well, on that note, I think I'll conclude, and I appreciate your time.
All right.
We really appreciate your being here.
Yeah, thank
you.
you for taking the time. Lucy, do you have anything else you'd like to ask?
I don't. Thank you so much for answering my questions and taking some time today. I appreciate it.
Okay. Well, we'll see you again on the 3rd Friday. Please do not hesitate to contact us via email at the phmedia@mendocinocounty.org account. You can also contact us directly as individuals. You can contact me at stuartm@mendocinocounty.org or 707-472-2601. Thank you for joining us today, and we are looking forward to seeing you next month.
Well,
Recording stopped.
Awesome. All right, is that it?